I'll call to order the Finance Committee meeting for Tuesday, October 12th. Let me do that again. Call to order the Finance Committee meeting for Tuesday, October 12th. Could we have a roll call, please?
Thanks. Mr. Lear?
Present.
Mr. Swanson?
Present.
Mr. Hess?
Present.
Ms. Polk?
Present.
Ms. Weber?
Present.
Mr. Payton?
Present.
Ms. Parker?
Present.
Mr. Fairfield?
Present.
Mr. Featherling?
Present.
Mr. Dunnell? Mr. Miller?
Present.
Mr. Long?
Present.
Mr. Hunter?
Present.
Mr. Wheeler?
Present.
Mr. Seroy?
Present.
We have a quorum.
I have no requests for public comment. Are there any requests for public comment? Seeing no requests for public comment, we'll proceed to the agenda items. We'd ask Anita Speckman, Mr. Lynch to come forward in terms of insurance renewals for 2022.
I'm good. How are you?
With the approval of the committee, I'm going to suggest that we have one motion for the first 5 items through the approval of the HAS contribution, and then we will discuss each item separately. So if we want to take some time for a discussion first, but then we'll just do one motion for those first 5 items, unless there's objections from the committee. All right. Then let's look at the dental insurance renewal first, please.
Good morning.
Good morning.
And as Mike mentioned, we're going to start with the ancillary insurance coverage. So, Kelly, do you have that presentation? It's actually the 5th page. I didn't number the pages, so I apologize for that. But the ancillary insurance is 100% paid by the employees. So there is no cost to the county. It's relatively, what do I want to say, stable in terms of where we're at. And so I kind of wanted to start with that before we get into the medical insurance and maybe go into some sort of a deep dive somewhere. So Blue Cross Blue Shield is our current provider. It was Dearborn. It was Dearborn. It was bought out by Blue Cross Blue Shield a couple years ago, so it's our same vendor. There is no increase in rates. It's not that I wrote on there are no additional quotes received, because in my comparison sheet from Mike, there wasn't anything listed. Mike indicated this morning there were some quotes, 2 other quotes, I think, but they were not competitive, so not listed. So no increase in the current rates that we have. It's a 3-year rate guarantee. Quite frankly, it's really a low-cost life insurance policy. They are term. So we do see when employees leave, they maybe want to convert to a personal policy, which is cost prohibitive. So what we know from that is that what we're getting for our employees is some very, very reasonable life insurance options for them. We have a $10,000 policy that the county funds for all employees. It costs $2.45, I believe, off the top of my head. That is funded by the county. The rest is all voluntary, which the county employees pay via payroll deduction, and then we remit payment to the insurance company. Our vision insurance is Blue Cross Blue Shield. We switched that last year. It had been VSP. It is a 3-year rate guarantee. There were 6 additional quotes received with varying rates. The Blue Cross, the key thing here is the Blue Cross Blue Shield option includes a 1% decrease in our health insurance. So by opting into the Blue Cross, the county saves about $50,000 on our health insurance policy, which we of course would give up if we went with a different vendor. It's very consistent. it uses the, what's? IMED. All of a sudden, I'm like, drew a blank. The IMED network, we really have had no complaints this year whatsoever with the switch. It was a little difficult, kind of behind the scenes difficult to make the switch. When we change a vendor that way, the feed, the software feed from one vendor to another takes about 60 days, and that did happen. It took us till about April 1st before the auto feed from our web benefits system, our software system that manages our benefits, switches over, feeds directly to the vendor. So meanwhile, what we're doing is manually adding people and manually making changes. So it took a little bit to do that. There was more behind the scenes work to do, but we recommend staying with vision. Dental, we did see several other bids, and if you flip to page 6, you can see what those are there. Our dental insurance is self-funded. Of the bids that were received, the UHC, Aetna, Humana, National General, and Guardian, you can see UHC is the only one that is fully funded, not self-funded. All of them are self-funded. The Delta Dental portion for the claim portion has not risen for 3 years. So there's an administrative fee that's included in this. The administrative fee has gone up a little bit. It did not change this year. What Delta is recommending and Mike is recommending is that we up it about 10%, which is $2 a month approximately, to increase that pool. If that pool for our self-funded claims gets depleted and we run out, then obviously the county has to fund it. So that's why we want to make sure it's adequate to pay all the bills. And Mike, what did you tell me about the overall cost of dental insurance, the increases you're seeing in those?
They call it dental trend. It's somewhere between 7 and 8%. And when you haven't raised it for more than 24 months, you begin to wonder, if we have a bad hit, will we go and deplete the fund of money that pays the premium or pays the claims? And then that means you'd have to dip into the county coffers to make up the difference. So we have to stay ahead of the game. So I think a 10% increase is more than reasonable. You can look at it over the last 2 years, it's 5 and 5 if you want. It depends on how you want to look at it, but I think it's more than appropriate.
Mr. Hunter?
Thank you, Mr. Need Mike, a general question, and you may not have this information with specificity. Overall, what have you heard in terms of the individuals who are covered, our employees, in terms of substantial complaints that have merit? I mean, some people call about anything, but can you guys speak to overall in terms of Blue Cross Blue Shield, Delta, and so forth?
Well, I will say overall, I mean, we really, and this goes to all our coverages, we don't get complaints. We just, for Blue Cross Blue Shield, Delta Dental, that is, in terms of behind the scenes, in addition to coverage, one of the things that's really important to our employees is how are their claims processed, right? Are they timely? So the employee's not getting past due notices on something that's sitting at the insurance company. Is the coverage what the employee expects to see? And what we get, is the network adequate? In the ancillary, I would say the network is excellent. In terms of Delta Dental, it really is. Between the premium dentals, dental providers and the regular standard providers, it's just really the most inclusive, I believe.
I'd add to that, what you said about network. Most of these networks have 2 columns, in-network and out-network. I'm sorry. Delta has three. I forgot how it's worded, but their top tier
That's Premier.
is the greatest discount that you can get. The middle tier is the average discount, and then the out-of-network is paid at what they call the 90th percentile. But interestingly, in that top tier, there's 20 dentists in the county that are a part of that top tier, and they're all in county. So I find that pretty interesting because PPO says go anywhere you want to as long as they're in network. So that could be here, there, or anywhere. So our local dentists are the beneficiaries of that. And it's the greatest discount. So.
Right.
Moving on.
Moving on to the last page, just a couple things. The HSA funding of the high deductible plan, that's a piece of the insurance. It's the very last page on the, so we would recommend continuing to fund the HSA, partially fund. The county makes a contribution to that high deductible plan. It is, what do I want to say? Fund $500 a year for single coverage, $1,000 a year for either plus children, plus spouse, or family coverage into an HSA for those employees that choose the high deductible plan. So that's a $5,000 deductible plan. So by choosing that, we're going to help assist the employees a little bit with that, choosing that higher deductible plan, which is a lower cost to the county, to kind of help fund that. So we would recommend we continue that, and you can see that when we get into the insurance comparison, you can see the costs there and the number of employees that are impacted by that plan. That's been going on for any number of years long before I got here. So that's been a benefit to those employees that choose that plan. And then the last thing is we'd like to continue the employee assistance program with Perspectives. That contract does not have an end date. It is until we cancel or they cancel or stop providing services, one of the two, but we'd like to continue on for another year. The cost for all our employees and their families is just over $1,000 a month, about $1,033. I will tell you that in the last 18 months, I have had many more calls for assistance. And they have a crisis counselor that will come out, and that counselor, they did send a counselor earlier this summer to the courthouse for that day. For it was kind of a grief session that day. So there are a lot of good things about, and I'll tell you, not just the mental health services. We have 6 sessions that either they can talk through with an employee or a member of their family any issue, or refer them if they believe that a longer term counseling is needed. So I'd like to continue that as well.
Are there questions on any of these ancillary insurance items? I'm not seeing any questions. So could you quickly review the recommendation of each of those 5 items?
Certainly.
Just so we're clear on the record what we're going to, a motion to approve your recommendation would mean.
Okay, we recommend renewal of the Delta dental insurance.
With
Delta.
Delta.
Delta, okay.
We recommend renewal of the Blue Cross Blue Shield vision insurance with a 3-year rate guarantee. We recommend continuation of the employee assistance plan with Perspectives Limited. We recommend the continuation of Blue Cross Blue Shield life insurance renewal both the group county-funded portion plan and the supplemental plan to our employees and their families. That as well is for a 3-year rate guarantee. We recommend continuation of the county's HSA contribution to those employees that choose the high deductible plan.
Is there a motion to approve that recommendation? Mr. Long? Fairfield. Polk for a second. This would be a roll call vote.
Mr. Lear?
Aye.
Mr. Swanson? Aye. Mr. Hess? Aye. Ms. Polk?
Aye.
Ms. Weber? Aye. Mr. Payton? Aye. Ms. Parker? Aye. Mr. Fairfield? Aye. Mr. Featherling?
Yes.
Mr. Miller?
Aye.
Mr. Long?
Aye.
Mr. Hunter?
Thorough explanation, appreciate it.
Mr. Wheeler?
Aye.
Motion carries.
All right. We'll move to the medical insurance renewal.
Okay, so Kelly, if you could go to the, well, it's the second page because the first page is a title page. You can see there the renewal rates, a comparison of the current rates and the renewal rates. All four. I drew a big circle around the end one because we can talk about the other plans. First off, on the far left is that high deductible plan that we fund an HSA for. So you see that and those rates and how many employees that impacts. 11, 22, 23, 24. 24 different employees choose that option. But if you look at the far right plan, that $1,000 deductible, that is 89% of our employees that are involved in our plan choose that plan. So when we talk about the driving cost of health insurance, it's really this plan. Now, throughout all of the, as we've talked, the overall increase that we got was originally started at 24%, right, Mike? 24, yes. 25, 24. And Mike was able to work with them to negotiate it down to 18%, right? It's high. It's high not because of our entire workforce. We have 14 high-cost claimants, which I've talked about in finance or in executive before, but it's really that top 3 or 4 that are really extremely serious and very high costs. So the overall age of our employees, I don't think it's surprisingly our employees. It's 44 versus a benchmark of like 45 that Blue Cross Blue Shield typically uses. The group as a whole has because then you're going to bring in kids, has an average age of 33. It's not the overall average age. It's not the overall health of everyone. It really is a few high-cost claimants. So we tried to look at alternatives. Mike took it out for bid. We gave Mike the whole census of everyone. He took it all out for bids. How many was it? How many providers chose not to bid?
We have 5 in our market, and we got bids from 1, and Blue Cross is included in that 5. So the 3 declined bid because of being non-competitive and/or what they saw in the claims experience. And that's not unusual. Companies that don't see the ability to, make something work won't throw a bid out there just for the heck of it. It's a lot of money. So I would say that UHC's bid is it's a good bid, but if you look at how they did it, they have 1 smaller network core, they have 1 larger network that's equal to Blue Cross's, and it's higher than Blue Cross's. So if you're looking at apples to apples, it's their larger network and it's higher than Blue. But their lower network is competitive, but it was without a lot of what I'll call,
Mr. Wheeler.
Just want to mention there were 3 bids. Aetna was the third one.
Yeah, I made a
Aetna
mistake.
came back. I just wanted for the committee's sake. And they
Aetna
were higher
did.
than all of them.
Right.
Aetna was higher. Forgive me. I this time of the year I get confused very easily. We've got 16 plans going on, and I made a mistake. But Aetna is a new player, and they hadn't been playing. So, but anyway, they did come in with an apples to apples bid network, and it was a good bid. But forgive me on that. But back to the issue of the networks, you know, we've got a certain degree of claimant right now that is using some specific facilities, and I don't want to go into it, but they're in the large Blue Cross network, they're in the large United Healthcare network. And of that, there are, I believe it's 14 claims that are cancer, and that one network is only in 2 of those, or excuse me, that one facility, that one entity is in 2 of these networks. It's not in their smaller network though. And so you have that to deal with, and it's a pretty serious. And then back to the large claim issue, you know, generally the rule of thumb in group insurance is that 20% of your claimants will be large claimants. It's just kind of a rule, an underwriting rule. But right now, this is almost, I think it was 33 point something or other of the total are large claimants. Now, once a claim reaches over $150,000, of which I believe there are 3, you know, that's written off, so to speak, doesn't count against your experience. That's just, it goes away. But right there tells you with that 30%, you know, how serious it is, because the claims month to month are running, or over the period of time this year, at 110%. Most generally, the carrier would like to see somewhere between 78 and 82%, if you will. I think Blue Cross told me earlier in the year that 82% would be beautiful to them, but it's continued at you know, 110 here for the last couple of months. There have been a couple of months at 121, 122. So earlier on, we had some lower averages, but you know, hopefully we see this stable. But I don't mean to be unkind, but you know, claims are claims. There's not much we can do about a cancer. There's not much we can do about something serious that pops up, and all on that list, and we don't know who they are. I don't want to get into a privacy issue, but there's some very, very serious claims, and they are at a level that is way over $50,000 in most cases.
So moving on then, if you go at the bottom, those comparatives, that's just, that's only for the portion in the 4th plan there down at the bottom. I just kind of plug that in there because that is of interest both to our employees and to the county. With the county funding 75%, you can see what that cost is of that increase per month of that 4th plan. So moving on to the next page, what we did is actually, once those rates came back, then we did take it out. You can see the UHC and the Aetna comparative there. The issue with UHC, as you say, is the network. When we compare a Choice Plus network, the rates actually were 1% higher, so comparable to Aetna. And in addition to these other hospitals that Mike recommended, I also wanted to make mention of the mental health aspect. The core network UHC is, the mental health providers is not comparative at all. As an example, in network for Blue Cross Blue Shield are 22 psychiatrists within 10 miles of the zip code, and 5 in UHC. So at a point in time where we're seeing more usage and more concern from our employees, we would be reducing their ability to find a provider near to where they live. So we then looked at an HRA. If you can go on to the next page, I just kind of wanted to make sure that you understand that we really did our due diligence to try and find another solution here. The Aetna we excluded, that cost was higher. The UHC we excluded after the comparison of the network, and then a cost of, we went back